Thank you very much for the kind introduction. It's a great pleasure to be in this important session, and it's a great pleasure for me to introduce this new topic into the DAR conference of driving and diabetes in Ramadan. So this is really an important point that many of us have been concerned about driving in general, and my objectives in this presentation is to cover a number of points. The first is reinforce the link between diabetes and driving mishaps. And then we'll want to look into the link between Ramadan fasting and driving mishaps in general. And thirdly, looking into specifically into this point of the risk of driving in Ramadan for some people with diabetes. And finally, try to explore what can be done to minimize the risk of driving mishaps in Ramadan for people with diabetes. So let's start with the first point. Of course, for driving in people with diabetes is well established for many years that a person with diabetes who might have impaired vision, peripheral neuropathy, amputation, or vascular events would have a problem. But the big one is hypoglycemia. This is the big issue that faces many people and can have an impact. Hypoglycemia can indeed affect the safety of driving, especially when the blood glucose level are below 70 milligrams per DL or 4 millimoles per liter. And obviously, the insulin is the major culprit here. Perhaps in the older fashioned sulfonylureas were as well. The more modern are still a possible hypoglycemia, but not as much as the older one. The symptoms of hypoglycemia varies from a person to person. And this is obviously an opportunity for us to discuss with a person with diabetes their current symptoms of hypoglycemia to reinforce what is it and certainly, of course, how to confirm it. So the consequences of hypoglycemia, there is some acute symptoms, as I've just alluded, there is mood changes, but more importantly, there is cognitive impairment that affects the work performance. But for the specific issue of our topic today is driving performance. Now, it's not just about the cognitive aspects, but from the musculoskeletal aspect as well. Hypoglycemia can have an impact on the musculoskeletal symptoms, leading to some driving accidents. When you focus on the cognitive function and mood in relation to hypoglycemia, this is clear when the person reaches a threshold below the 3 millimoles or the 50 milligrams per DL. It does affect the ability to do complex tasks, such as memory and attention, concentration and abstract thought, the rapid decision-making, and hand-eye coordination. It does not affect the accuracy, but it would affect the speed of doing that task. And obviously, when we have a cognitive impairment because of hypoglycemia, the effect would last on average about at least 45 minutes. This obviously have an impact, a negative impact on the mood of the individual, which can make him more stressful and certainly is unpleasant attitude. Now, Cox and his colleagues in research from the year 2000 have told us that people with type 1 diabetes, when they are put into driving simulators and they look into the impact of hypoglycemia, there were frequent mishaps or crashes. There was speeding or driving too slowly. There were inappropriate braking, and there is driving off the road, crossing the midline of the road and ignoring the traffic lights, the stop sign, which obviously could be very important. So it does look that also driving as a mental exercise has a significant metabolic demand, which can lead to lowering of the blood glucose level. Now, there are factors that are well established that increase the risk of severe hypoglycemia in insulin-treated people with diabetes. Now, when Cox did his research and published this, they didn't take into account Muslim persons fasting the month of Ramadan or fasting any other days consecutively. But we know that strict glycemic control, impaired awareness of hypoglycemia, history of previous severe hypoglycemia, deficiency or lack of sleep, duration of type 1 or duration of insulin therapy on type 2, age of the individual, renal function of the individual or renal impairment rather, and depression. I would like you to remember these important points because we will come back to them. I want you to reflect, please, on many of these points, which are indeed some of the parameters of the risk stratification for our people with diabetes when it comes to the decision of fasting. So what Cox did in his study in 2009, published in Diabetes Care, he looked into 452 drivers of type 1 diabetes and looked into the records of mishaps in relations to episodes of severe hypoglycemia. And he found that 52% reported at least one hypo-related driving mishap, 32%, nearly a third, reported 2 or more, and 5% reported over 6 events. So clearly, the link between hypoglycemia in a person with type 1 diabetes is well established. Now, what are the factors that increase this? The distance of the driving, the history of severe hypoglycemia in preceding year, and history of hypoglycemia-related driving mishaps. So it does look like once a person have a problem, it can be repeated again, and the severe hypo can obviously do this. And the duration of driving is a common sense, because if I'm driving for a short duration, perhaps the chances of this happening would be much less. Now, Seniorovich, in his study of 2013, published in Diabetes and Obesity and Metabolism, he looked into type 2 diabetes patients treated without insulin. And obviously here, we know that many drugs are rare to cause hypos. Sulfonylureas are more common to cause hypos. And dark blue is the hypoglycemic episodes with the risk of accidents. And the light blue is no hypoglycemia. And he also looked into the age difference. So it's interestingly that the older generation with type 2 diabetes not treated with sulfonylurea, accidents are not highly related to the therapy and hypoglycemia. While in the younger group, this is over double, nearly 2.5 times the incidence. So let's now move to the link between Ramadan fasting and the driving concerns or mishaps that we see. One important study published 5 years ago did look into this, and they found that there is a small increase in traffic accidents, in accidents involving death, as well as total number of death and injuries and injured persons during the month of Ramadan, because obviously we all know everybody is rushing, everybody wants to go back on the same time at home. The potentials, of course, of the low blood glucose level, the stress, the anger. We know the roads are packed with drivers during the month of Ramadan, specifically during these last few hours. And in UAE here, the newspapers on an annual basis, they have articles about, as part of a campaign to make people try to calm down, slow down, not to rush, drive appropriately, because the reality is, as you can see here, the number of fines, the number of sort of driving wrongly, which leads to a fine, were much higher during the iftar traffic rush. Now, sleep deprivation is a problem that some people during Ramadan are struggling with. Now, that also can lead to more problems. And my serious personal concern is the impact of this on people driving trucks. They are known sometimes to be traveling for long distances from country to country. And because of the sheer size of their vehicle, their accidents are not small. So this is something on top of the fasting and the impact on the blood glucose level or the stress. There is the deprivation of sleep, which could be a important factor. The Dubai Statistics Center publishes among what data they publish on an annual basis, the rates of accidents in Dubai. And they publish it as well on a monthly basis. And moreover, I was pretty lucky to see that the data is also published as daytime accidents versus nighttime accidents. I tried to look into the dates that matches the month of Ramadan, and that's why I said approximately, because the data is published according to the January to December calendar and not the Hijri calendar. So I looked into the overlapping months and took the average versus the average of the rest of the year. So in green is the daytime accidents in Ramadan versus the rest of the year. And you can see over the last 4 years that were published, they haven't published the 2022 data yet, clearly there is an increase in the daytime accidents. I have communicated with the Dubai Statistics Center, and they are very kind, have accepted my request to try to look into the Hijri dates and also to look into the timing of the road accidents. So clearly there is a concern, and that concern is being established. Now, when you think that, for example, insulin, hypoglycemia is certainly higher in people on insulin. And this is data from the latest DAR Global Survey. You might see this data, or you might have seen it already. I'm not sure about the timing of the presentation, but in general, regardless of the type of insulin, the basal insulin without sulfonylurea was the least of hypoglycemia at 15%, but in other types of insulin, with or without sulfonylurea, it can reach up to a range between 22 to 25%. So nearly a quarter, from 15%, let's say 1 in 5, depending on the type of insulin people are using, 1 in 5 are exposed to hypoglycemia during the month of Ramadan, based on the data from the DAR Global Survey for type 2 diabetes, which included 12,000 persons. Now, how serious is hypo? Well, over 10% of those insulin users of type 2 diabetes, and this is not type 1, type 2, obviously type 1 would be probably higher incidence of type 2 diabetes, needed to go to ER or admitted to hospital. So clearly, it is not something to be taken lightly. Furthermore, when you look into the timing of hypos in type 1 diabetes, well, nearly 40% of them are between 3 p.m. and sunset time, Maghrib time. And 23% are from midday to 3 p.m. So this is the time where the traffic, when everybody is rushing and the roads are busy and the stress is for everyone. For type 2 diabetes, which constitute the majority of people with diabetes, the timing of hypoglycemia for insulin-treated patients is also the highest, is late afternoon to Maghrib time to sunset time. So clearly the peak of the hypos is happening at the peak as well of the rush hour and the peak of accidents. Accidents indeed are highest at that time. This is a publication from one of the news agencies, where they are trying to do a campaign to help people to drive safer during Ramadan, and they collected data from 6,000 insurance claims during Ramadan. And they looked into the timing of the accident, and the vast majority, the peak of the accidents were between 2 p.m. and 5 p.m. So more or less matching exactly the timing of what we saw of the individual with diabetes having the hypos treated with insulin, and in general, the risk of hypos. Now, what is of concern as well is that in general, from Graveling et al. Data on diabetic medicine over nearly 19 years ago, as well as from other data from 2015, that nearly 50% of people with diabetes in general, before they drive, they do not check their blood glucose level. And 14% only who were checking on a regular basis. In the other study of Inkster, published in 2015, there were about 1,000 persons out of a total of nearly 10,000 persons, 10,055, nearly 1,000 persons, 10% never checked. The 40% of them were checking on occasions. And these are insulin treated with people with type 2 diabetes. So clearly, a sizable proportion do not check, or they are checking occasionally. I looked into the Dark Global Survey data on those with type 2 diabetes treated with insulin. I didn't look into the type 1 because the majority of the drivers are type 2 diabetes persons. And as you can see here, it ranges from 30% to the minimum of 17%. So probably the average is about 25% of type 2 diabetes persons treated with insulin plus or minus sulfonylurea are not doing SMVG. That is a great concern. Another concern is over 14 to 12% of them are checking less frequent during Ramadan, when the logic tells me we should check more frequent during Ramadan. So clearly, this is an important issue that we need to try to address. Now, many colleagues, including our good friend, Dr. Salim Bishaya, and colleagues from UK, have voiced their concern of this topic and published their information 5 years ago. Going back to the risk calculator, and I would like to remind you with the aspects of the risk of severe hypoglycemia that obviously would be linked to the risk of having road traffic accidents. Hypo unawareness, recent severe hypos, frequent hypos are all factors that can lead to this. Type 1 diabetes, long duration of diabetes, insulin use, or possibly sulfonylurea as well. All of these are factors in the risk calculators, and indeed, there are factors for the risk of developing severe hypoglycemia or recurrent hypoglycemia, which obviously can impact a person with diabetes who is driving specifically into the last 3-4 hours of Ramadan. So here is the points that have been mentioned before: the impaired awareness of hypos, the history of previous severe hypos, the duration of diabetes and type 1, the duration of insulin therapy for type 2, age of the individual, which is also a factor, renal failure, which is also a factor in the risk calculation. So I'm delighted that all of these points are already included into our risk calculation, and perhaps not only when you're advising your person to fast or not to fast, the driving issues, how frequent does the person drive, how long is the duration of driving, what is the timing of driving, are all very important factors. So what should we do? Now, of course, common sense, and this is cartoons from the DVLA about how we best should do pulling over, i.e. stopping on the side, switching the engine off, taking fast-acting carbs. My problem in Ramadan, many people are reluctant to break their fast, specifically if it's only 1 or 2 hours left. And obviously that's the time of peak of the accidents and time of peak of the hypos. So reinforcing to a driver on insulin or even on other therapy that if you have symptoms of hypos and you're driving, you must do these aspects. You must stop and you must not drive again for 45 minutes. Checking the blood glucose level before the start. Perhaps CGMs would be even better to predict and to give the person an inclination on what's going on. Driving when the blood glucose is above 5 millimoles per liter, that's 90 milligrams per DL. And stopping if it's below 4 and breaking the fast, of course, and then taking a break, making sure that the person is safe before consuming driving again. Emergency kits in cars are important. For a person with diabetes, this is double important. Having strips, having a glucometer, having batteries for the glucometer, having the necessary insulin, but more importantly, having snacks that are with simple sugar are really quite important, or glucagon kits for obviously for people with type 1 diabetes or people who can get severe hypos and hypo unawareness. Certainly, they shouldn't be driving a person with hypo unawareness until they recover from that problem. Other simple measures, and we see this in the streets of UAE here, where even the police is giving meals for drivers to ask them to slow down, to not to panic, to break their fast, drink, have a snack, decide the street meals that are happening in many countries such as Egypt and Pakistan, and certainly many other countries, is really important. Perhaps a driver knowing where is the next place for such a meal would stop to avoid. Obviously, this is specifically for people with diabetes who are concerned about breaking their fast. After all, our target is a safe Ramadan, and specifically safe Ramadan for someone prone to have a hypoglycemia if they are driving at the wrong time. Thank you, and I look forward to the questions.